Thanks for staying with us here at midday. A sleep disorder can make it difficult to help your child transition from summer to school. Dr. Shane Gailushas from Mercy Medical Center's new ear, nose, and throat clinic is here today. Thanks for coming in. We appreciate it.
No trouble. Thanks for having me.
We're talking today, you hear about sleep apnea in adults a lot, but today we're talking about pediatric sleep apnea. So what is that?
So pediatric sleep apnea is the same as an adult, and it's just a condition where you either stop breathing or you don't breathe deep enough, particularly while you're sleeping. And it can lead to a reduction in oxygen levels, and it causes the body to have to make up that difference, and so it affects other systems in the body. And just like adults, we're discovering more and more that kids can be affected by this as well.
Are there certain kids who are more prone to this than others?
You know, there are, but it's a small percentage. So kids that are more heavy set tend to be more prone, as it is in adults. And also kids who have certain syndromes, like Down syndrome tends to be more prominent. However, it can really happen in a wide variety of kids, and the percentages show that, you know, if there's concerns, you should still have it checked out, even if they don't fit the standard definition.
If there's a parent who's been diagnosed with sleep apnea, is their child more at risk for it too?
You know, interesting, but no, they're not, because the kids are affected in a much different way than adults. Kids tend to be much more affected by the opening of their throat, which is affected by their tonsils and their adenoids, and it's why they respond so much better to cure from that procedure than adults do.
So what is the cure then for pediatric sleep apnea?
In most kids, it'll just be a routine tonsillectomy. So they'll have their tonsils removed. Sometimes the adenoids are removed. These are tonsil tissue that sit in the back of the nose, helps them to breathe through their nose better. But that cures roughly 85 to 90% of kids. Wow. Some kids will still potentially need some help either through CPAP or something along those lines, depending on their body habitus and if they have any pre-existing conditions, but most kids do very, very well with a simple tonsillectomy.
That's good news. So what are some of the symptoms to look for if you think your child may be affected by pediatric sleep apnea?
You know, that's a great question. You know, some of the symptoms are actually subtle that kids have always had. So for example, we see roughly 50% of kids who have sleep apnea also have some bedwetting issues, and we also see a lot more hyperactivity in kids. So these are kids who maybe are having attention issues. Some kids still get the sleepiness. You know, you try to wake them up in the morning and they just are groggy. They're kind of always groggy through the day. Another big sign is just listening to your child. So loud snoring, and we're talking very loud snoring, is usually associated with pediatric sleep apnea. But even kids who have mild snoring still could be affected. So following up with the pediatrician, kind of going through some of these profiles to see, could this be a problem for them, really helps.
Well, it's certainly, with a cure out there for it, it's certainly worth checking out if you think your child might be affected by this. You can also give Mercy Ear, Nose, and Throat Clinic a phone call. We've got that number there on the bottom of your screen if you have any questions or maybe want to follow up with this interview today. Doctor, thank you so much for coming in today.
Thanks. And
coming up tomorrow, our Hy-Vee dietitian will join us to teach us a lesson in food safety as we prepare lunches for a new school year.